Well, you don't have to wait much longer because the Zika virus could be here, and for more than just a few hundred pregnant women in the United States, try a lot more in the United States. Dr. Kelly Powers, a noted physician and surgeon. So, doctor, what are we in for? What are they saying?
Hi, Neil. Great to be here. Great to see you. Yeah, so the new update is that there is a new mosquito that has been identified. So what we know, we had the Aedes aegypti mosquito. This is the mosquito that's been endemic to the subtropic and tropic regions. It's affected Brazil, Florida, the Caribbean, and has been quite the scare. The mosquito that's endemic to the northern cities, like San Francisco, New York, Boston, Chicago, is called the Asian tiger mosquito. Now, according to a new study and new research that's been out there, this mosquito that's endemic to us here has shown positive for the Zika virus. So, of course, this is causing a huge scare with everyone, as it should be.
Now, who's in danger with this sort of thing? There's no cure for this, but who's vulnerable? How bad does it get? What do they have to look at?
Right. You know, I think the scariest thing about the Zika virus is so much is unknown. We're kind of, for lack of a better description, kind of sitting ducks. Of course, pregnant women. So pregnant women is the #1 threat, the threat of having a microcephaly. So the virus spreads through the placenta and could attack the nerves and the brain in developing this microcephaly, this kind of small brain with brain damage, vision impairments and such. So that's obviously the #1 paramount threat. But all of us are susceptible. Symptoms include flu-like symptoms, acute onset fever, malar rash, which is a rash on the face and the nose, conjunctivitis, muscle pain, arthralgias, and the list goes on. Flu-like symptoms lasting about a week, potentially up to 2 to 3 weeks. The other big unknown is that there's a lot of disagreement in the community, in the scientific community, of how long this virus stays in the system. So, you know, does it leave after the duration of the virus symptoms, or does it stay in the body for a year, a couple of years? And there's quite the debate about that right now.
You know, these women, there are nearly 300 of them who are carrying the virus. Right. What percentage of them do you think could have their baby compromised? And is there a test or anything that would ease their minds?
Yeah, you know, it's tough. And there isn't, according to a recent article I was just reading from the New York Times, there isn't a widespread test. But when you have someone who has high susceptibility, high probability, someone who has traveled to these endemic areas and showing signs and symptoms, and if they're pregnant, there's something called an ELISA test, and there's molecular studies as well. So it's blood samples, tissue samples, and it's quite involved. And, of course, that means, you know, costing money as well. But these women obviously should contact their primary care physicians, OBGYNs, infectious disease physicians, and get tested. So.
Doctor, well put on. You rifled through quite a few options there.
Yeah.
Thank you very much.
Okay.
Dr. Kelly Powers.